Hello, my name is Kawane, and today I'm going to introduce you to my research, named Can Exposure to topiramate during Adolescence Program Permanent Vascular Dysfunction in Rats? The developmental regions of health and disease describe that adaptations to environment disturbs, as the use of medication, during periods of development plasticity can have a long-term impact on individuals' health. It's important to note that adolescence has been described among the periods of developmental plasticity. Topiramate is a drug approved by FDA for migraine prophylaxis in adolescents. A few studies, such as this two, have described that top treatment increases the risk of vascular disease in humans. However, the effect of top treatment during adolescence on vascular function has not been investigated yet. So, the present study aimed to evaluate the vascular reactivity of adolescent and adult Wistar rats after top treatment during adolescence. For that, Wistar rats were treated with top 41 mg/kg a day by DOHaD or VICO from postnatal day 21 to 50, which corresponds to adolescence period. During all the treatment, body mass gain and food intake were followed. After the treatment, both groups were evaluated at PND 51 and PND 120. And what methodologies were used? First, the indirect blood pressure and heart rate was measured by a tail cuff blood pressure system in conscious rats. Also, in vitro thoracic aorta reactivity was evaluated to the vasoconstrictor phenylephrine in the presence or absence of endothelium and to vasodilators acetylcholine and sodium nitroprusside. The aorta thickness was evaluated through hematoxylin eosine histological technique. My results. First, there was no difference between the control and top groups for food intake and body mass gain. Also, the blood pressure and heart rate were similar between top and control groups at PND 51 and during the adulthood at PND 120. To talk about vascular reactivity, in the next graphs, the control is represented in blue and top in red or pink. The response to phenylephrine is shown in the graph as tension in grams per less log of phenyl, while the response for vasodilators is shown in the graph as percentage of relaxation per less log of drug concentration. Here we have the results of vascular reactivity at PND 51. As you can see in the graph, the aortic maximum response to phenylephrine was higher in top group compared to control maximum response, and the endothelium removal abolished this difference. The response to the vasodilators was similar between the top and control groups at PND 51. About the vascular reactivity at PND 120, we can see the aortic rings of top and control rats in the presence or absence of the endothelium showed a similar response to phenylephrine. However, the aortic rings of top group present a decrease in PD2 for acetylcholine with a similar maximum response when compared to control. Aortic thickness was similar between the groups, both at PND 51 and PND 120. In conclusion, our data demonstrate that treatment of rats with TOP during adolescence using 41 mg/kg a day promotes permanent impairment of endothelial function, suggesting that this exposure during adolescence may program vascular disease in adulthood. Thank you.